We're at the beginning of writing the history of Donald Trump's stewardship of this pandemic. And the epitaph, scrawled across this era, should be those four words. We want them infected. I'm joined now by the reporter who broke that story, who has been one of the great reporters of the Trump era, got his hands on those emails, Dan Diamond of Politico. And Dan, I want you first to just set up for me, who was Paul Alexander and who was Michael Caputo, and what role did they play at HHS?
Chris, thanks for having me back. Paul Alexander, part-time health professor from McMaster University in Canada. He became a scientific advisor in the Trump administration. For most of the pandemic, he advised Michael Caputo, the department's top public affairs official, who was also a confidant of President Trump. President Trump personally installed Caputo in the department. So to put it in simple terms, Paul Alexander was the hand-picked advisor to the hand-picked head of federal health communications during the pandemic. And for months, Paul Alexander sent emails to CDC Director Robert Redfield, FDA Commissioner Steve Hahn, other officials urging them to let Americans get infected. Young Americans, middle-aged Americans without pre-existing conditions, infants, to accelerate what he and others in the administration believed, this idea of herd immunity, that by having so many relatively healthy people get infected, it would be a way to contain COVID, allow the president to reopen the economy. And when some officials got these emails, like Kyle McGowan, the former chief of staff of the CDC, a Trump appointee, we spoke today, McGowan said, when I got these messages from Alexander, I assumed he was speaking with the weight of the White House.
This is an important point I want to just reiterate and quote from your story here. It was understood that he spoke for Michael Caputo, who spoke for the White House, said McGowan, a Trump appointee who was CDC chief of staff before leaving this summer. That, in any administration, the org chart doesn't really matter. People have different titles, they're going to that place. What matters is your proximity to the president. And if you're out in an agency, and there's someone there who is speaking for the president, that carries more weight than any title or any office you sit in generally, because it is understood that this is what policy should be.
I think that's fair, Chris. There were public health officials who, at the beginning of the pandemic, looked at what was happening to Alexander Vindman or other officials, career officials who spoke up during the impeachment process and were shown the door or seen to be punished. They didn't want that necessarily happening to them, so they would give officials who seemed to be speaking for Trump a pretty wide berth. And in the case of Paul Alexander, this was a guy who did what he did for months and months without any resistance that we saw.
I want to just quote another line here, because again, it is shocking to read this, but this was explicit. The bottom line is, if it is more infectiousness now, the issue is who cares. That's Alexander writing in July 3rd email, the health department's top communications official. There's a long period in the history of this pandemic where that thinking, as represented by Scott Atlas to the president and the sort of